All right, we are good to go. So welcome everyone. Today is April 15th. The time is 10 a.m. on the dot, and the meeting of the Greater Boroughs Partnership for Health Advisory Board is now called to order. So the open meeting of the Northborough Greater Boroughs Partnership for Health Advisory Board is being conducted remotely, consistent with Chapter 2 of the Acts of 2025 relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the advisory board are allowed to participate and encouraged to participate remotely. The public is encouraged to follow along, and we are live streaming on YouTube. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So with that being said, members, when I call your name, just respond in the affirmative. So Taylor, Southborough.
Here.
Anne Marie Boylston.
Here.
And then Isabella Crusoe, I, Northborough. And then I will make sure to check the waiting room to see if anyone from Westborough joins. But with that, welcome, Taylor, welcome back. And then Michaela, if you want to share your slides, I can make you a co-host.
You see that?
It's loading. There we go.
Okay, perfect. Okay, so we'll get started here. Quick agenda. This was sent out. We're just going to talk about the budget, kind of looking ahead towards FY26, and also talking about spending down for FY25. And that will probably be the bulk of our conversation. And then we'll have a couple updates on the FPHS review, and then approve meeting minutes from March 13th, and then look at future meeting dates. So to get started on the budget discussion, kind of want to focus on some specific goals for today. We're not like officially in FY26 planning, but in talking about how we want to spend down the rest of this year, that kind of involves looking towards next year, primarily looking at if nursing software is something that will fit in and we can continue doing if we end up procuring it this year, which kind of involves talking about some of our staffing. So that'll be kind of looking at ahead, and then we'll also discuss spending down for FY25 with what we're currently planning on spending, and get any other ideas from you all. So we're kind of taking a looking forward and then looking back approach when we're talking about the budget, because there are a couple of things in the future that are helpful to be aware of as we talk about how we want to spend money. One of which is the state's new metric platform, which was recently announced and has been kind of in the works for a while, but essentially will be a new data platform that will start being rolled out in the fall of this year. So kind of starting in FY26, they're going to release 3 different phases of this. The first will be food, housing, pool complaints. So essentially what Relevant does will now be rolled into Metric. And then release 2 will be similar in working on grants and work plans. I don't know if anyone on this group uses Smartsheets, but that was what we use to kind of manage this PHE grant. So essentially that will be release 2, and then release 3 will be the full-fledged, I think we'll include some applications and analytics piece. Still figuring out exactly what this means, but essentially by FY27, Relevant will no longer be something that we pay for, which will free up about $30,000 in FY27. So this is just kind of helpful to keep in mind, not necessarily impacts FY26, but just kind of wanting to make people aware of the long-term plan. So Isabel and I tag team breaking this down, but we kind of took what we've spent and what we're estimated to spend for FY25 to look forward to FY26 and talk about what potential options we might have with software and staffing. So Isabel, I don't know if you want to cover the salmon contract and then I can talk
Yeah,
about
yeah,
software.
absolutely. So I will just again take a step back. So the budget you see here is just some options for FY26, and it's only public health excellence funds. So the contact tracing funds, if you've been following the news right now, that those funds, they're in like a temporary restraining use. So we're not actually going to use those until the final court decision. It's just a little bit too risky and uncertain of a grant. But this one, we have a contract until FY27, and then they're looking at trying to see if there's any other, ways to get it in the state budget. So I just wanted to clarify that piece first. The salmon VNA contract. So currently in FY25, we have 30 hours a week at $65,000. And then we can do some per diem hours for CPR, AED trainings, or additional services at $45 an hour. Currently, for FY26, what we have heard is that the contract rate will stay the same. So that's $65,000 for 30 hours a week, but the per diem hours will increase from $45 to $75. So that's how you can kind of see it in option one and option two. Right now, option one is kind of accounting for, about $5,000 in additional per diem hours, whereas option two is just the contract. So that's the main difference. So I guess I'll walk through option one, you can ask questions, and then we can walk through option two. So option one is really kind of status quo. It's what we have right now. So the staffing cost is for our full-time health agent, Michael, and then our full-time shared service coordinator / EPI, which is Michaela. So two full-time positions. The estimated fringe is estimated for FY26 for the increase in health insurance. And then the salmon contract we just went over, that would be the 30 hours a week, which with some wiggle room, excuse me. And then the software, which I know we've been talking about a lot, that number would include the relevant software that we have right now. That's for all of the environmental health inspections. And then adding Tableau, which Michaela can talk a little bit more about, but it's a, data analytic tool. And then MyJuna, which is one of the softwares we're talking about. This is estimated for MyJuna because it's a little bit more expensive, but if we preferred My Senior Center, we could plug that into, no problem. And then the supplies, training, hardware, health communication, we kind of lumped that all together, and we just estimated the same amount from last year, which we have usually had some wiggle room in anyways. The admin support fee is standard throughout. So does anyone have any questions about option one? That would have us still having like $26,000 remaining. Do you want me to go into option two?
Yeah.
Okay, so option two is slightly different. This would have us hiring a part-time nurse, so it would be around, like 14, 16 hours. So that would be, we estimated it around $45 to $48 an hour. The fringe would stay the same. It would not be a benefited position. And then the salmon VNA contract would stay at the flat rate of $65,000. The software would include Relevant, which is, status quo throughout all of these options. And then adding My Senior Center, which is the slightly less expensive option for nursing and like human service software. And then everything else stays the same. So it's really just thinking about whether we want to add nursing hours and also what type of software, if any, we would like to add for FY26. I will also add that the state is looking into possibly creating a statewide HIPAA compliant nursing software. When that will be taken, I don't know when that will be put in place. Anne Marie and Taylor, you might know better than me. But
I'd say at least FY27 if it happens.
Okay.
Question, just not super clear under the software.
Mhm.
So for FY 25, you have 36,000, and then under option 2, it's also 36,000.
Yeah, so the contract, I think we added some like wiggle room to maybe I think last year we were thinking we were gonna add something, so the relevant software is 32,000.
Okay, so it's just the line item.
Correct, yes.
Okay, thank you. I thought that was like what we actually
Oh,
spent.
no, no, these
Okay,
are
no, that makes more sense. Okay, thanks.
budgeted.
That was really my only question. I would say, the only thing with the nursing piece is that, like, when would we have to make a decision on the contract by? Because go ahead.
The software contract,
No, the nurse contract, the salmon contract.
they're gonna send it out beginning of May.
And when do you need to return it by?
I'm not sure, but probably sometime, I would say in June, at the latest.
Okay. Because I'm just curious if, I mean, I think I'm personally leaning towards the 16-hour nurse, but if we don't hire someone, is there wiggle room to do our contract later with salmon? Or
I
add
to like
that
amend
piece?
the
Do you know what I
contract.
mean?
Yeah. I mean, I think if we weren't able to offer or hire a part-time nurse, we would be able to just add per diem hours.
Then I think that's what I would be in favor of.
So currently we use per diem hours for our CPR and AED trainings and like additional hours when needed, like during
Right.
flu season.
And then if we hired a 16-hour nurse, we could do that in-house internally, have more flexibility with when things are, and then if we weren't able to do that, then we could just add those per diem hours on the salmon contract.
Mhm. I guess, Michaela, can you go to the next slide and maybe just debrief? Because I think in these two options, we're comparing two nursing software, so it might be helpful just to jog our memory about the two options.
Yeah, we can. So Penny and Jim also recently did a demo. So this is kind of just like synthesizing their feedback. Like Isabella mentioned, my Juna is the more expensive option because we probably would be pretty close to the 10 user threshold. So it's about $2,000 more for the first year. My Juna is really nice for like individual nursing and detailed clinical notes. And has some kind of nice tracking features in terms of time and things like that. Um, so great on the individual level. My senior center is more geared towards kind of like the event planning. It does have some really nice integrated outreach capabilities where you can send bulk emails to people and keep track of how many people attended events. And it does still have a place to keep notes on individuals and kind of track interactions in that way. And it is a lower cost and it's not per user. So it's just a flat rate. And we wouldn't have to worry about number of people having access. So that's kind of, is there anything else you wanted me to touch on?
I don't think so. I remember when I did the demo and it feels like so long ago. My Juna's definitely more aesthetic. But
Pretty,
my
yeah.
senior center, I do think the reporting options, and that's really a big piece of this, right? Like we want to be able to report on all of the nursing and human service related activities we do. And I do think my senior center was able to do that in a great manner. My Juna also had capabilities, but some of them you had to pay additional. So that, you know,
And just to clarify, Isabella, does your town already use my senior center and the senior center?
at the senior center, yes.
And do you know if Westboro and Boylston do?
I am not sure.
Okay, because we also do, and our um youth and family uses it as well.
Okay.
So
Is
like
it
I
the
know it would be
same?
IT approved, basically.
Okay. Is it the same contract for senior center and family youth or two different?
I'm not sure, but I could find out.
Okay.
I don't have a preference. I think I was pleasantly surprised with my senior center's demo. My junior is definitely like has all of the like nursing pieces that you would need, but my senior center could work also. It's just an older software.
Anne Marie, do you all use any software at the senior center or at the health department?
At the health department, no, but as we speak, I'm actually reaching out to our Council of Aging
Okay.
director to see if we utilize either.
Okay. So I guess, Michaela, if you want to flip back to the previous slide. So I'm not sure if this is something we want to vote on today or make another meeting in May to kind of think about this and then vote on it and start the contract process.
I'm fine with either.
What do you think, Anne Marie?
Until I find out from Council of Aging, I don't want to make a decision on that.
Okay. Okay. And then did you have an opinion about option 1, 2, or any other ideas? I mean, we could come up with more options if that was something you all were interested in.
Oh, no, until I find out, and I would still collaborate and see what Sarah, before she leaves, and what the Council of Aging, what they would feel comfortable. Since we
Okay.
don't have a giant base like the other towns.
Well, I think it wouldn't be for Council of Aging though. Like we would just be utilizing it in the health department.
Right, right. We were just thinking about if they already had similar software, just because the town would need to approve like the IT and all of that. So I guess, Michaela, if you want, we can continue. We can see if Anne Marie gets a response, but we can also schedule a meeting for the beginning of May if that's also something.
Yeah,
we'd
I
prefer.
think that sounds good. And Jen maybe would have a chance to look over the slides and kind of provide any input they have from their perspective.
Okay.
So that sounds good. So now kind of, again, working backwards in some ways, thinking about the end of this year, kind of due to delay of hiring and things like that, we have some additional spending to do. So this is just a list of where we can spend things as a reminder, and I can flip back to this slide. Um, but for reference, this is kind of where we're at and where we expect to be. So in the kind of white color here is what we budgeted, what we've currently spent, what we anticipate spending. So kind of projecting out the fringe benefits that will come out, the remaining staff costs, remaining salmon contract, and then some other supplies that we've already ordered or are in the pipeline. And then totaling all of that to kind of see where we'll probably end up. So we'll still have 21% of our budget, which is a little less than 100,000 to spend. So want to get any ideas about how to spend that. I'll go through kind of what we already have and are thinking about spending on, and then we can talk a little bit more about any other ideas that people have. So EpiPens, we did get this approved by OLRH. Estimated cost of roughly 3,200 to purchase 7 2-packs. So 14 doses total, which gets very confusing. But 3 child packs, 4 adult packs, and just wanted to vote to approve purchasing those. This would be for vaccine clinics that we host to have them on hand in each town.
So do you want a motion?
Yes, and just to clarify, it would be for, because Boylston, Anne Marie, do you guys don't do vaccine clinics, like Salmon VNA through Penny does them for you?
Correct.
Okay, perfect. Yes, Taylor, I would welcome a motion.
Okay, I make a motion to approve the spending of money to buy the allotted amount of EpiPens.
I second.
Okay, perfect. All those in favor, Taylor,
Yes.
Emery?
Yes.
Okay, and Isabella, I. Perfect. So, Taylor, I'll work with you because I know you have the Henry Schein account and we can
Yeah.
get that processed as soon as possible.
Okay.
Perfect.
Perfect.
you.
So we've already chipped away at some of the additional spending. And just for reference, we've talked about most of these things previously, but some things we're already planning on spending funds on. We have printed the GBPH brochure in the English version, and we are also going to get that translated into the 4 languages that we selected. So that's being translated now, and then will also be printed. Same thing for the maternal health guide and the food resource guide, which we're currently just revising to make sure everything's up to date and it makes sense. And then we'll translate and print those as well. We're also going to purchase nursing supplies, the EpiPens that we just talked about, gloves, and then other vaccine clinic supplies so that we have those on hand. And then upcoming trainings, the MHAB or MAHB, their annual local board of health certificate is coming up in May, and we have 5 people registered for that. And then MHOA, their early bird registration should be coming out, and we've kind of budgeted for roughly 9 staff to attend that and register. Are kind of some other spending ideas. But also happy to hear if anyone has ideas. I can flip back to this additional spending page.
Would we be able to purchase 2 AEDs for Boylston?
What was that?
Would we be able to use some of the money for 2 AEDs?
So the AEDs are not allowable under the Public Health Excellence Grant. They were allowable under the Contract Case Investigation Grant, but unfortunately those funds are frozen right now.
Am I frozen?
Or they're in the courts, they're in the process.
Okay.
So we should know whether we'll have those funds, I think in like maybe 2 weeks, I think, Michaela.
Mhm.
But that's,
Hopefully.
you know, though we're waiting for the state to let us know.
Is that the same thing about the sunscreen?
Correct. We actually did ask OLRH, so the Public Health Excellence Grant, about the sunscreen, and they may accept that as like a one-time allowable expense, but we have not heard from them yet. But if so, that would be a great expense. Yes, agreed.
And I think I told you this, but I desperately need needle boxes.
Yes, sharps containers.
Yeah.
So if it's okay with the group, I don't know if we want to make a motion to vote, but we do have a lot of nursing supplies that we can purchase. If Michaela works with each town, is the board okay with us purchasing, or do you want to vote for each, like
individual item?
What was that?
Individual item?
No.
No, you can buy what you need.
Anne Marie, do you agree?
Yes, I agree.
Okay, so Michaela, maybe next week just reach out to each of the towns to get a list of, you know, vaccine supplies, items that they need, really focusing on that nursing supply so we can get that order
Do you
in.
need me to, do you want me to make a motion for that? Or are you good with just doing it like this?
I make a motion, that's fine.
Okay. I make a motion that the greater boroughs can make a decision on what nursing supplies need to be bought without another vote.
I second.
Okay, all those in favor, Southborough?
Yes.
Boylston? All right.
Aye.
Isabel, aye. All right, perfect. So we will make that order and then we'll provide a list of all of the supplies and then pass it out accordingly. So that's one thing. Anything else? So the software, if we do vote on it either today or May, we could possibly get a few months of a contract, so that would also help that line item. Office supplies, we were able to get Michaela and the Northborough Southborough shared agent their logoed apparel that we got last year. So that was a great use of the one-time expense as well. I think both of you are going to the MAPHN conference. I think we've already paid for both, but just let us know if that has not been processed.
Mine's all set.
Okay, perfect. And I know Penny's going to that as well, which is great. And then Anne Marie, I think you're going to MAHB.
I am.
Okay.
I haven't gotten anything in the mail. Have
I
you?
haven't either, so I'll reach out to them because I think it should be just one invoice, so I'll reach out to make sure that that's all set as well. And that's May 10th. And then Michaela, when you reach out to the towns, maybe also ask about inspection software. I'll ask Chris and Michael, but I've been kind of doing it as needed and they haven't mentioned anything of recent.
What do you mean?
Or inspection supplies,
Yeah, sorry, what did I say?
Oh, okay.
software.
Oh, no, no more software. Supplies, sorry. Thank you. I think the
Yeah.
health communication piece will be a awesome thing if we can get that translated in time and then printed as well. It's been anytime we have a tabling event, the food resource guide is one of the first kind of like brochures to go. So I think it's a great
Have you
resource.
asked about like mailers?
No, but
Or
I
no?
can.
That could be good.
Mailing the food resource.
I mean, maybe, or whatever else we have, like just, or like a little
Postcard.
thing with a QR code or something.
Yeah, I can ask. So that would be what, sending it to every single house in all 4 towns?
Yeah.
Okay.
Or if we wanted to target certain houses, we could do that too.
Okay, all right.
And translating any flyers or things that people have could be another way to kind of incrementally spend funds, especially static flyers like hand washing or food safety if we want to get those. Canva does technically translate, but I think I trust the translation services more. So if there's anything like that that communities have that would be nice, we can look at translating that.
Well, just keep thinking and let us know. Send us your ideas if anything comes up, but we will keep chugging along.
Perfect. Okay. And in that vein, most of these, especially through like MHOA, there's not a lot of cost associated with, but did kind of want to provide this list. It'll be sent out afterwards. Most of you probably get these through emails as well, but for me, having it in one spot is helpful because there's so many emails. These are just some trainings that are coming up in the near future. One is tomorrow if you want to attend the tobacco monthly office hours. And then MHOA has the tobacco training at the end of April as well. And then I think the rest of these we mostly talked about. The
Yeah.
MHOA quarterly meeting. Oh, sorry, go ahead.
No, I was just going to add, yes, the MHOA quarterly meeting, that's May 22nd in Needham. So that is free and members are welcome to join. The MIHA annual seminar, I know Michael and Chris signed up yesterday. So I think it's like $125. So that's in Southbridge at the end of May. So another training.
Yeah. The quarterly meeting will be on food trucks, I think.
Awesome.
So
I think it actually has a cost associated to it though, Isabella. If you're
Okay,
going to
sorry,
the food
I
truck
misspoke.
portion.
Okay. Is that out yet?
I don't think so.
The cost?
The signups or
No.
registration?
No.
Okay. All right, Michaela, once we see that out, we'll circulate that.
Yeah.
Thanks, Taylor.
Yeah.
Okay. And then
Everyone's favorite thing.
We're almost there. The service delivery tool is due this Friday. Each town did have a couple of revisions on the cost tool as well. So if you haven't gotten to those or you still have questions, feel free to reach out to myself or Monize. But for the most part, those are good to go. And then the service delivery tool is due this Friday. I think, Isabella, you can correct me if I'm wrong. The service delivery tool is easier than the cost tool. It's a little bit more of like, it's subjective in some ways in terms of thinking of things, but you don't necessarily need to have like a budget or things like that on hand. so can be relatively quick. But that being said, if you want to set aside time to just work on it with someone else, feel free to email me again or Manize, and we can do that before Friday. And then Manize will be here at our May 8th meeting to go over our results and kind of talk about, give us our data back essentially. So any questions on this before I move on? Since I know everyone loves hearing about it.
No, I would agree. It's a little bit more straightforward, I think, the service delivery tool.
Okay, so I'll leave that. I'll leave you all with that. And then just approving March 13th meeting minutes. They should have been sent out. Hopefully everyone had time to look at them. And if there's any edits or things that need to be changed, let us know.
I was not present for that meeting, so I'll abstain. I don't know if you can vote on it then or not. Isabella.
Michaela, who was in attendance? Do you remember?
Jen, Anne Marie, you, and Chelsea.
All right, maybe we'll hold off
So we
until the
can-
next meeting.
We can
All
wait.
right.
No worries. And then next meeting date. So for sure, we're all meeting May 8th. We will be getting into budget season. We've already talked about it a little bit today, but wanted to see about the possibility of if people want to add a June meeting as well, before our next meeting in July.
I think
so
it's
you
a
have
good
time.
idea to add one. I just won't be here that day.
This was just to give us a
Yeah.
starting point, but we can choose a different day. I think the Thursday
I
before
would
that,
probably recommend maybe like the week before, just so we have,
time.
yeah, because that
If
would
we
be
need
like
to
the
meet
end of,
again after
right.
that.
right.
Yeah.
So maybe
Isabella, the week before is Juneteenth.
okay, so let's see. What about the 12th? Oh,
Um,
That's
Thursday the
MAPHN in person.
okay. What about the 18th? Wednesday the 18th?
it's fine with me.
That's fine with me.
What time works best?
Right now, my whole day's open.
Same with me.
Can we do,
I have a meeting at 10:30.
okay,
But
so we could
free
either
any
do
time.
9 or maybe like 1.
One.
Yeah, one sounds great.
All right, Jen is joining, so let's maybe ask first. Hi, Jen, how are you?
Hi, so sorry. I'm the only one in the office today.
No worries at all. We were just actually trying to plan a meeting for June, so we were thinking June Wednesday the 18th at 1. Would that work for you?
That works.
Okay, perfect. So we will add that meeting for June to do any last minute budget or spending. So Michaela, now that we have Jen, can you go back to, I don't remember, slide like 3, just talking about the options?
Oh, yeah. This one?
All right, yes. So I will recap. So Jen, so we got the Salmon VNA contract. So it's the contract itself is not increasing. So for 30 hours a week, it is $65,000. The difference is right now the per diem hour rate is $45, but it's jumping to $75 an hour. So option 1 is kind of status quo. It is the salmon contract with some wiggle room for per diem hours. So like CPR trainings, any flu support assistance. The software we kind of added all of the software and then included MyJuna as the most expensive option, but could also switch out My Senior Center. Everything else is status quo, and we would still have around $26,000 of wiggle room, or, you know, thinking about a different project. Option 2 is adding a part-time non-benefited nursing position. So thinking along the lines of like 16 hours, keeping the Salmon VNA contract at the 30 hours per week, and then continuing with relevant, but adding My Senior Center. And this is just to add some part-time nursing hours to allow us a little bit more flexibility of the type of programming or community health workshops we could offer through Greater Boroughs.
What was everyone's consensus?
So I don't want to speak for you, Taylor, sorry.
That's okay. So I had said if my thoughts were if we tried to get my only concern is that we wouldn't be able to find someone, but I'm leaning towards the 16-hour nurse and then getting rid of the salmon per diem line item, which they're increasing to $75 an hour, and utilizing that person to do like our trainings for us, like CPR, Narcan, and then whatever other community programs we have. And then that way, like, we're more flexible in what we can do. But then if the contract doesn't work, we can always, or if we, excuse me, if we don't get that person, then we can always go back to utilizing the per diem line item for the salmon contract.
Did we decide if we're doing MyJuna or My Senior Center?
We did not decide. The only thing is option 2, we wouldn't be able to fit in MyJuna. So I think, Michaela, if you want to go to the next slide.
Mhm.
So Jim and Penny were able to do a demo with Michaela. I think they had differing opinions. I think both are fine and good software. MyJuna's definitely more heavy on like the nursing, like not that we would bill, but you could bill, and there's a lot of different options there. My Senior Center, there is a secure place for notes, but it's also, you could do like scheduling and planning events, some outreach. It does like, I think, blast of emails and phone calls. So, you know, a little bit different of the software types. That being said, the state is working on a statewide HIPAA nursing human service software, but I do not know when that will be out. Probably not next year or the following year. I'm not sure.
Can you go back to the previous slide, please?
Mhm.
And then Anne Marie, I know you were asking about if your town uses My Senior Center already. I don't know if you had an opinion on option 1 or 2.
Yeah, no, I'm still awaiting
Okay.
response from her.
Somebody out here, who's.
I'm on a meeting. I'm in a meeting.
Okay,
Thank you.
the others can be in tomorrow.
Yeah, who is it? Do you know?
He's.
Sorry.
No, that's okay. So Anne Marie, you would want that information before you would vote. Is that correct?
Thank you. I'm sorry, what?
No, I was just asking Anne Marie. She was trying to figure out if the Senior Center already uses My Senior Center.
Correct.
Jen, do you have any strong opinions? We can also kind of think about this and vote at our next meeting as well. We have one on May 8th, which is only a few weeks away.
No. I think I need more time. Sorry.
Okay. No, that's totally fine. I think Anne Marie does as well. So Michaela, will send out these slides, talk it over, but also like feel free to reach out with questions, or if we want to change around, like these aren't just the only 2 options, we can try to see what else will work with the numbers.
Yep.
Perfect.
Sounds good.
And then
Jen, I was looking at it, so I was looking at it more from like a staffing perspective than a software perspective. So, I mean, see what Jim liked, but the only reason why is because I did do both and I didn't really have a strong preference either way on which one we picked. So,
Yeah,
um,
I get the feeling from him as well that he didn't either. He'd be
yeah,
fine with either, but he did prefer one a little bit over the other, but he'd be fine with either. He's flexible.
okay.
Yeah. Perfect. So then I guess moving to current day, so we'll send out these slides, we'll think about it and we'll vote on May 8th. But we're still looking for ideas as always to spend down a grant fund. So if there are any other ideas that come up, feel free to reach out to us or Michaela. We're working on getting the resource guides translated and printed, so hopefully that will be a good use of funds. We got the EpiPens approved, which is great. And then Michaela will also be reaching out to each town to get a list of nursing supplies and inspection supplies that staff are in need of.
Are we getting another clothing allotment?
No, it's one time per staff forever. So we were
Forever.
able to get it for like Michaela, which was great.
You would think they would do it yearly or, at least bi-yearly because clothes get worn out, you get stains on them.
Especially like inspectional
Yeah,
clothing. Yeah,
maybe we could bring that up again.
I would hope. I
I can
mean,
try.
I don't fit in mine anymore. They're too big.
Yeah, I will try, but
Yeah, people change sizes, like,
Yeah.
seasons change. I'm just kidding.
exactly. We learned from our mistakes of getting all heavy stuff.
Yeah, we can
How much
always-
more do we have left to spend?
Great question. So we kind of mapped out what we have spent and what we're planning on spending with the remaining year. And even with all of that, we still have a little less than like 100,000 to spend.
Ooh,
Crazy.
Yeah.
and we need it. I mean, it's important that we spend it. So
Yeah,
it's
especially
rough. That's a
now.
lot of money.
Yeah. So, and we've reallocated some of it because of the staffing delay. So we have a lot more in supplies and training that we can look at spending. We talked about the EpiPens. We're translating the guides, planning on purchasing vaccine clinic supplies, but then any other trainings that people want to attend or supplies that they think of, or translating flyers that you already have on hand that would be helpful to have in other languages. That would be a good way to use some of the additional funds while we have it.
Have we had anyone sign up for the breastfeeding clinic?
We have 3 so far, and I was going to push it out again on our Instagram, but also please feel free to push it out
No, yeah, I
anywhere
will, yes.
else.
Can you send it to me in a
Yeah.
JPEG?
Mhm.
Thank you.
Then we do have, I think, 3 or 4 CPR trainings before the end of the fiscal year. So that is per diem nursing hours. So that would increase that line item as well.
Mhm. And those were the only dates that she was available, correct?
Correct. Yeah, I think there's one in Southborough. We're planning one in Westborough, and I think there's one in Northborough.
And there
I
was
think
one
you guys
last
had
night.
one yesterday too.
Yeah, there's one last night.
And Penny is getting up and running. She is technically trained. She just wants to practice a little bit more, but once she's ready, she'll be able to offer the CPR training. So that will
That's great.
help our scheduling because I know it's really hard. And they fill up very quickly,
Good.
especially around the summer. All right, well, keep thinking. I know it's challenging without, I think it's a staffing and training grant. So,
Yeah.
and that's why I think thinking about FY26, like how do we maximize our staffing capacity? All But I think that is, so
Where are we
upcoming,
standing? I mean, I remember the last update you did, you gave us about the hoarding.
yep,
When can we start that?
that is already started. So I
Oh,
think they're
okay.
already working with a Westboro resident.
Oh, how did they find out about it?
So I think they were already working with them previously, but now that there is funding available, they're able to support more. I can ask for an update. So for May 8th, I can see how many clients they're working with.
Great. And do I have a contact info or someone can send me contact info?
Mhm.
That'd be
Yep,
great.
Michaela, it's Lynn from ClearPath, and we can send that out as well.
Thank you.
And then Jen, the MIHA annual seminar is at the end of May, so if Ray or Maria or anyone wants to sign up for that, that would also be allowable. I know Michael and Chris just signed up yesterday.
I don't know, going back to ClearPath, I don't know. Did we do, and I may obviously have missed it, did we do like a formal announcement about that? Like, can I send it to my senior center staff so that they know that we have it? Can we write something up about it?
Sure. I'll
Thank you.
ask Lynn if she has anything like pre-made. If not, we can draft something.
Thank you. That way we can do a referral if we need to.
Which I think is important to note, Michaela, if you want to go back to like slide 3 with the options. Neither option right now has the ClearPath contract. So if that is something we wanted to continue, option 1 has $26,000 remaining, not saying we would put that much.
Okay.
But that's something to consider as well.
How much is the ClearPath contract?
A good question. Actually, I wouldn't know the whole year because it was only like March to June or April to June, but I can let you know
Okay.
in the email.
Yeah, that would be helpful.
I think we only did like 4 hours a week too, so it wasn't, half the year was $4,000.
Okay, so it would be theoretically 8.
I
All right.
know that I would push to keep fund or
Yeah,
contracted with them, so just an FYI, I would
Yeah.
be pushing for that.
all right.
Sounds good.
I think we have a list of 38 houses now.
Wow.
You want to go to I think the few end slides.
Yes, yeah, I'll follow up with all the additional information and I can include the ClearPath in the slides when they're sent out too, just so
Okay.
we can have it all in one place. Touch on this again just because Jen, you weren't here, but the service delivery tool for the Foundational Public Health Service review is due Friday. Offer still stands if anyone wants to set up time just to go through it together or talk through it. Feel free to
It's
reach
not
out.
the problem of actually doing it. I have no problem doing it. It's just I mean, if I'm gonna do it, I don't need to have anyone help me. It's the time of, like, if you wanted to do it, that'd be fine, but I can't. I just don't have the time. And I'll
I
get to
hear
it
you.
like I did last.
No, and I don't think it's I think sometimes just having another person can be helpful, but I don't think that anybody can't do it themselves. It's very straightforward.
Yeah.
And I hear you on the time. If I had been here before, I would say that I could do it and help you with that if I knew historically what was going on. But yeah,
No, I totally
unfortunately,
understand.
not this time.
I was just throwing it out there.
But no, I hear you. It's Friday. I will try not to bug anyone, but yeah, just a friendly reminder. And then
I guess we could vote on the meeting minutes
I
now.
think we can now.
Did anyone have any edits or corrections? I know Taylor wasn't here. Do you want to make a motion, Jen?
Sure, I make a motion to accept the meeting minutes of March 13th.
I second.
Okay, all those in favor, Jen,
Yes.
Anne Marie,
Yes.
and Isabella, I. Perfect. Okay, so we will get those sent out as well and posted on our website.
Beautiful. And we already decided not June 26th, but we
Nope.
have a meeting date for June 18th at 1. that we'll add, but then our next meeting is May 8th.
May 8th is at 1:30. It's our like regular scheduled advisory board meeting. Perfect.
Yeah.
Not 1:30 a.m.
Oh, I changed that. This is from last time we were meeting at 10 a.m.
Michaela, you might be sitting on Zoom by yourself.
Yeah.
I would be asleep. Okay.
Well, I will accept a motion to adjourn, and then Michaela will send out all of the information. Think about it, ask any questions, and then we can vote on the following meeting, May 8th at 1:30 p.m.
I make a motion to adjourn the meeting at 10:50 a.m.
Second.
All those in favor, Anne Marie,
Aye.
Jen,
Yes.
Taylor,
Yep.
Isabella, aye. Perfect. Well, it's so nice to see you all. We will see each other in a couple weeks.